Carpal tunnel syndrome. Carpal tunnel EMG NCS of upper limb decrease median motor and sensory latency in left carpal tunnel. Compressive neuropathy affecting median nerve in carpal tunnel at rest. Abnormal median study. Abnormal median study. Prolonged distal motor and sensory latency. CMAP and snap amplitude decrease in case of demyelination with axonal loss. CMAP and snap amplitude. Motor conduction velocity less than 49 millisecond and prolonged minimum F wave latency. Combined sensory index more than 0.9. Abnormal prolonged distal motor more than 4.2. Sensory more than 3.5. Combined sensory index more than 0.9. Normal ulnar study. Ulnar sensory motor and F wave latency normal. Confirmed diagnosis in unilateral by nerve conduction study comparing the median nerve with other sound nerve like ulnar nerve in the same hand in case of upper limb amputee patient. Small difference in between median and ulnar latency are significant. Ulnar and median are significant, that is 0.4 to 0.5. Diagnosis to confirm by ultrasound of wrist. Advantage of USG over NCS. USG is not an alternative to NCS but may be complementary. USG is not an alternative but may be complementary. It has certain advantage like low cost, shorter time, non-invasive, low cost, shorter time and non-invasive. Confirmation of nerve compression, more value in secondary case show any lesion causing compression of the nerve. Is there any fixed criteria for surgery? Absent snap and CMAP showing prolonged latency. Absent snap and CMAP showing prolonged latency with decreased amplitude. Other entrapment site at ligament of Struther at or immediately below elbow by pronator teres, anterior interosseous nerve entrapment by flexor digitorum sublimis and flexor digitorum profundus. And clinical feature of carpal tunnel more common in female. Numbness and paresthesia in the radial 3.5 finger. Awakening in the night with the numbness and pain. Flick sign. Relieving of symptoms after vigorously shaking of hand. Weakness and atrophy of thenar muscle. Common etiology are idiopathic repetitive stress, occupational hazard, wrist injury, endocrine, thyroid, diabetes, acromegaly, rheumatoid, infection, inflammation, sarcoid, tuberculosis, histoplasmosis, tumor, ganglia, lipoma, schwannoma, neurofibroma, hemangioma, pregnancy, amyloidosis, spasticity at wrist.
डिफिकल्ट है तुम्हारा भी यार।
भगवान